wonders of the world. So many wonders to behold. So many questions in my mind. So many questions, so little time. Answers don't so easily come unless you know to ask someone who is a master of the trade. Ask them how clouds get their shape. Welcome to What the Heck Is That with David Shai Ventura. Welcome everyone. We have an exciting guest today. This last year, we have all been affected by COVID-19. I don't know about you, but I have a ton of questions about it. So today we have Dr. Cheryl Pollack with us to answer some of those questions. So let's see what she has to say.
Great, thank you. Pleasure to be on, and what a wonderful pleasure to meet with you, David. I'm very proud of all your work. Glad I can contribute.
Can you start by telling us what kind of doctor are you?
Yes, I'm a pediatrician. That means that I take care of people who are newborns till they're 21 years of age. I practice general pediatrics, but I have a specialized area. I'm a psychopharmacologist, and that means that I treat patients who also are teenagers and older who need to be on medication for attention and focus and mood and things like that. And now I'm the COVID queen. This new pandemic has made me want to learn so much about COVID-19 that for my office, I'm the one who answers all the corona questions.
Gotcha. How long have you been a doctor?
I have been a doctor for over like 25 years.
Wow, that's impressive.
That's just old.
How has the coronavirus infected your work?
Oh, wow. Coronavirus has affected everything about a doctor's work as much as it's affected everything about my being as a mom, as a wife, as a daughter. I have a 97-year-old father who lives with me. It's Corona 24/7. It's all we do. And this new virus has created a reason for the entire world to come together. All of the scientists from around the world have gathered to learn all about this virus in hopes of stopping it, in hopes of preventing it, in hopes of curing it. And what we have seen, if you're a science nerd like me, an amazing, amazing thing happened where all the scientists have come together. The virus broke out in last 2019, so last winter. By January, Chinese scientists had already assembled the genome. They knew exactly what this virus looked like in proteins. They sent it because of internet around the world to teach all of the world and the scientists what this virus looks like. And these scientists have worked so tirelessly, so full of effort, 24/7, that by now, less than a year, within 10 months, they created for the entire world the vaccine that will hope to cure coronavirus. So it's affected the whole world. What it did to me is, of course, being on the news all the time. Last year at this time, I was reading horror stories about what was happening in China and then Italy and Spain about this virus that has come to town that people did not know yet what it was, but it was doing terrible things, including the doctors, the nurses, the people on the front lines who were caring for sick people. They didn't know what it was. They didn't know how to prevent it. And they too were coming down with the illness and dying in big numbers because they were heavily exposed. So at this time last year, 25% of frontline care workers were being so affected they were dying. That freaked us out. So we all scrambled to learn about it and what we could do. And the best thing we learned is prevent it from ever getting to you in the first place. So my office and the doctors all around did everything we could to learn how to prevent it and protect us from getting it. Our office became a very safe space. Once we learned that it was airborne, of course, everybody's wearing masks all the time and face shields because the germ can get into our mouth, into our nose when we breathe, or into our eyes. So protecting with a face mask and eye shields was, first of all, new things we started to wear. But we also learned that distance, being separated, was also helpful. So in our office, we created a space. We took our waiting room and we got rid of all the furniture and we spaced things out. And to be really honest, we don't even have people waiting in the waiting room. We escort them up into a room immediately, but there's no place where anybody can be in our office and be closer than 6 feet. We created a new protocol so that we have to find out where people have traveled and what they were doing before they can even come into our office. Now, that was a year ago when we thought this was a virus far away from home. But by March, it was not far from home. It was in our front yard. So we do screen people. We are careful, but we've also now started to look at patients outdoors. So we do screenings outside in our parking lot. They finally gave us masks. They finally got us tests. The scientists worked very long and hard to figure out how to test and identify this virus. So we've protected us, and now we're identifying who has it. And we go, my office staff go in their hazmat suit, their mask, their gowns, their gloves, downstairs to people's cars and do testing to find out if that patient has coronavirus. We also changed in an amazingly important way how we doctor. So this is my office. I'm in my garage, which is now my office, because I do this kind of doctoring. I do something called telehealth. That's something our office also started up, and most doctors' offices and practitioners' offices have these kind of visits on the computer with our patients to allow them the privacy in their home, protection in their home, as well as not have too many people who are in our office who might spread germs. So this coronavirus has changed everything. Now, in addition, doctors around the world had to learn all this new stuff. I spend probably 30, 40 hours a week reading as much as I can of studies and good information to learn about what happens with this virus and how we can protect against this virus. And when you don't know something, you get really frightened. That was my experience. New virus, new thing. I think the whole world got frightened. Most of our newspapers are capitalizing, taking advantage of that fear. And when they report things, it's sensational, like, oh, killer this, and extreme, bad, awful thing that. And so people read about it and hear all the negative things. I'm a science nerd. Knowledge is power. So the more I read to understand, the more I understood and didn't feel so frightened and understood how to move through this crisis. But I wasn't alone. And that's the other key ingredient is connection, community. So a band of pediatricians in my community got together. They were so smart to start texting with each other. Hey, what's going on? Are you scared too? What should we do? What do we do about testing? What do we do? I saw a case like this. And so we were communicating every day and every night. Whenever we had a question, I had a good, smart pal at my fingertips who I could text and find out this information. And we realized this community was so important to us. This connection of people to talk to was so important to us. We knew this was needed for our families too. We were seeing our moms and dads and kids in our office who didn't understand what was going on. They needed to learn. So our band of collaboration of pediatricians started a Zoom, kind of like what you do, a YouTube, to find out what the heck is this. And so we found out what the heck is that coronavirus, but we didn't use your name, David. We got our own name. I don't know, community parenting Zoom. And every Monday night for free, we doctors, and now we have a bunch of psychologists, mental health practitioners, specialists, who are the professionals on the Zoom call. We have many parents who for free come on our Zoom call every Monday night, 7 o'clock. And we talk to them and answer all of their questions about the changing landscape of this coronavirus, how to treat it, what's going on with it, how to understand it. And in fact, we will give you guys a flyer so that you can put up there if parents want to join in on our Zoom, this or adults or teenagers. This coming up Monday, after this tape airs, will be a session for teens and about teenagers dealing with all of the complications and stresses of how to stay locked up and how to be okay about that. So we've been teaching the community, we've been teaching ourselves, we've learned about protection, and finally, the brilliant scientists launched a safe and effective vaccine. It was the most magnificent thing to see scientists at work who could figure out what it would take to vaccinate to prevent the coronavirus, the COVID-19, from being a problem. And I see the light at the end of this long lockdown tunnel. We are going to be safe. These vaccines, we've never had 95% effectiveness at preventing serious disease or death from corona. That makes our hearts so glad. So the vaccines are launched, they're being given, they're expanded as of this week in Los Angeles. They've announced that people who are 65 and older can become vaccinated. As soon as we get so many people vaccinated, we will have a much different life. So yep, it's been, to answer your question, all corona, all the time. It's changed our whole world. And hopefully we'll get to a newer, better normal soon.
Thank you for explaining all of that. I can imagine how difficult this has been for you. If you guys are interested in those podcasts, I will link them down below in the description.
Thank you.
What has been the hardest part of the pandemic for you?
Well, that's a good question. You know, I think for all of us, this idea of being locked down, this idea of not being near people, this idea of things about being connected that had to stringently stop and change. So my 97-year-old father lives in my home. We take care of him. And because of that, we cannot bring germ into our house. So of course, I, as a doctor, couldn't do my doctor stuff in my usual way. I had to change, as I said, how I work. So I've been in my house since March. And that hasn't been hard because I'm an optimist and I try to take lemons and make lemonade and do the best we can to change. But I am a rule follower. And so not going out has been important. And you know, the other really hard part is just watching on television, you know, or social media where they make it scary. So there's been a lot of scary feelings and a lot of overwhelming feelings. And, you know, when I saw the news the other day and I saw, oh, so many people are dying and intubated in the hospital, all those scary things. And then the very next news segment was, and then all these people who are outdoors without their masks in big crowds, whatever they're doing. That caused me such painful feelings of infuriation. Like, how dare they? Don't they just see the last segment on the news where people were dying? It's a very simple thing to do to try to honor the public health message of wear a mask. It stops the germ from spreading as much as it's been spreading. Our hospitals in Los Angeles are overwhelmed to the point, and it's awful to talk about, there is not an ICU bed in Los Angeles. There is lineups out the door. We have overstressed the people who've been running these hospital systems, and now we're in a surge upon a surge. So it's just the emotions of this pandemic. Fear, terror, infuriation, overwhelmed, feeling like it won't get better until people are listening to the public health message and getting their vaccines. I am the optimist. I see a light at the end of this terrible pandemic. We will get through this. We've got to band together and do it right.
Yes, it has been so hard, but you are right. We have to follow the rules. Can you tell us why this is different from other sickness?
Well, yes. So like I said, it's brand new. So before last winter 2019, it hadn't been around. It came, and doctors didn't know what it was, know what it looked like, know how to prevent it. We have learned tremendously about the stages it and what it does into our bodies, and how to manage it better. And now we are learning, and we are having the ability to actually prevent infection by having vaccines. So the newness was different. And at first, people were guessing, well, what does that mean? And so some of the guesses were that corona is a known upper respiratory virus. It should be simple. It should be easy. It was more complicated than that. It did things to the body so that the body responded way differently than our human bodies usually respond to upper respiratory infections. So it wasn't a simple cold. It wasn't just like the flu. And what it proved to be is a virus that we now know takes 2 to 14 days after you get spit on, get sneezed on, or breathe in the germ. It takes 2 to 14 days to start to affect you. That's called the incubation period. And so that's a long incubation period. You can have a germ that you've come across in your body on Monday and not feel sick until the following Wednesday. And if that happens, what happens between Monday and the following Wednesday? You're walking around and you're spreading a germ, because you can be contagious 2 days before you actually feel the symptoms. So there's a long lag time between when you're exposed and when you come down with it. That gives everybody 2 weeks to go out and spread their germ because they had no idea. That's one bad thing why this coronavirus really spread incredibly well. You can give the germ away 2 days before you even feel sick or become sick with it. So that means you feel healthy. I didn't know it, but I spread it. So that's another thing about it. Another really bad thing about it is it affects people differently in different ways. One way is totally nothing. 40% of people who are ill with coronavirus get nothing. They get nothing. They feel fine. They're not feeling ill at all. They didn't even know it. So you got sick people who don't feel bad, who don't know why they have to stay at home and quarantine about it, and they're spreading germ. Some people get so super sick because it gets into their body and it affects their body differently because of the way their body is, the germ makeup, and the way this organism works. So it's very unpredictable. Yeah, many people do just fine. I mean, they get through some very bad symptoms, high fever, bad headache, feeling all body achy. I mean, that's not pleasant, but they get through that. That's most people of all age groups. However, there are many people from all age groups who actually get so sick that they get hospitalized and die because this germ is so new. None of us have any resistance to it. We've never seen it before, so our body didn't have natural ways to be immune to it naturally. So big, huge populations are getting sick. They didn't realize they were sick. They didn't realize they were spreading it. And so older people can tend to get super sick, and they have the highest morbidity and mortality, meaning sickness about it and actual death because of it. I'm a pediatrician. I'm very happy to say I work with the healthiest population. Little kids do quite well with this virus. And for them, it would be pretty much true. 80%, 90% of little people do very well. They don't go to hospital. They barely have symptoms. The youngest kids, less than 10, do very well. Over 10 behave more like adults, but the population ages have different outcomes. Unfortunately, so new virus, we didn't know about it, spreads stealthily, very efficiently. We now can vaccinate. That's great. People didn't know they were sick, but they were giving away germs. Some people get super sick. But now, unfortunately, we've learned that there's something else, and that's called the long haul. And what we're finding is people who were barely sick of many different ages, not just the elderly, but all ages, can have something called the long haul where they've gotten sick with coronavirus, and coronavirus gives them a lingering malaise, a lingering illness. And part of that illness might be symptoms in their brain, symptoms in their heart, symptoms in their lungs, symptoms just in their overall activity or their kidneys. There are long-term symptoms. I mean, this is a nasty, nasty virus. Finally, viruses are viruses, and mutation, changes in their coding, in their DNA, and their what they look like, changes to make them hardier, to make them stronger. So yeah, we expected mutations and we expected variants. We now have a variant of the original SARS CoV-2 virus. Now that's changed and morphed, and I'm sure you're hearing about that in the news. The new variants are very efficient. They are even more contagious. So even though the future looks bright and we've got something in the future to look forward to hopefully protect us, the vaccine, we also have a virus that is trying to change up a bit to be more efficient and continue to make us sick. So lots of things have happened.
Yes, I think this is why it has been scary at times. All right, everyone. Make sure to come back next week to watch part 2, but in the meantime, stay safe, everyone. What the heck is that? Wonders, oh wonders of the world. So many wonders to behold. So many questions in my mind. So many questions, so little time. Answers don't so easily come unless you know to ask someone. Who is a master of the trade? Ask them how clouds get their shape. Welcome to What the Heck Is That with David Shai Ventura.